Hi, this is Giardina again. Welcome back with another video of Total Sports Therapy's Community Spotlight with the physicians in the local Phoenix, Arizona area. Today, joining us today is Dr. Adnan Saithna, an orthopedic surgeon here in Phoenix. Welcome. Thank you for joining us.
Thank you.
So, Dr. Saithna is newer to the Valley. Just give us a little background in terms of how long you've been in the Valley, where you were practicing in the States before,
So I've been in the Phoenix area since January, but I've been in the United States for approximately 2 years. Prior to moving here, I was a professor of orthopedic surgery at Kansas City University, and I was a member of a small private practice in the Kansas area. And prior to that, I was in practice in the UK for about 5 years. So in total, I've been in practice for about 7 years.
Okay, awesome. What ultimately what brought you down into the Valley from being?
My wife's been based here for a long time, so she's the boss.
Okay.
Yeah.
As most of them are.
Yeah.
Was there was she working down here when you were overseas as well, or what brought
She
you to
was,
the US?
yeah. We had a long distance relationship for a while, but she didn't like the weather in England. It rains a lot, and she couldn't get used to it being from Phoenix. So ultimately, we wanted to move here. Phoenix is a great place to be. We love it here, and so glad to be here.
Nice, awesome. Were you kind of always interested in orthopedics when you got in? Like, what kind of took you to med school and then ultimately into orthopedics?
So I think I always wanted to be a doctor as a kid, but I didn't realise I wanted to do orthopedics until I was in medical school. And like most things in life, I had a really fantastic mentor who inspired me. He was actually an orthopedic oncology surgeon, which is bone tumours, and often dealing with bone tumours either in very young patients, children, or elderly patients. But some of the surgery they do is just amazing. But I was lucky enough that he was my mentor, and he actually helped me to get one of my first research publications. And that was a really important publication. What we demonstrated was that patients in the UK actually had a worse outcome from treatment for some types of bone tumours, and we identified that it was due to differences in chemotherapy to different parts of Europe. And actually that study led to a change in chemotherapy in the UK in part, and so that was really exciting for me as a medical student to do something so impactful. Because he was such a great mentor, it just inspired me to do orthopedics. But as I progressed further in my career, I realised that I was much more interested in sports medicine, so that's what I do now. So I focus on knee and shoulder minimally invasive and arthroscopic surgery.
Okay. Is some of the surgical techniques, are they, I mean, from what you were doing for the 5 years over in the UK, pretty much a smooth transition to some of the things here?
Yeah, even though the health systems are quite different, the actual decision-making process and surgical treatments are very similar. There's some small differences in terms of what treatment options are available. So one very exciting thing that's about to be released in the US is called an in-space balloon. It's for people who have very big rotator cuff tears in their shoulder, but it's not possible to fix them. And what this balloon does is it creates a space within the shoulder and relieves pain due to rubbing of the two surfaces. And that's something that I've had extensive experience with in the UK, but in the US it hasn't been FDA approved yet, but it's going to be approved in about a month or so, we think. So I'll be one of the people with the most experience in the US with that particular technology, so I'm excited about that.
Oh, so that gives some. So you're talking about somebody who maybe has a pretty deficient rotator cuff shoulder, but isn't necessarily needing a replacement or any.
Well, there's some overlap between the different populations. So some people might be best served with a reverse shoulder arthroplasty, but they might be not necessarily medically fit for it, or they might not want to undertake the big risks of a big surgery.
Sure.
And this is a quick 10-minute procedure. So it's much safer for people who have other medical conditions like diabetes and heart and lung problems. But it's also very quick and the risks are very low, so it's a very safe procedure. So it's got some big advantages over a shoulder replacement.
Okay, gotcha. Is this, since we've met, I've been kind of wanting to ask you this. How have you seen, from a therapy standpoint, how is physical therapy over in the UK much different than it is here in terms of philosophy and practice?
I think there's actually a very big difference between the UK and the US in terms of physical therapy. Part of the reason for that is that most physical therapy in the UK is government funded, and so whenever that's the case, the resources are limited, and the amount of time and input that individual patients get from a therapist in the UK, as well as what facilities are available, are quite limited. But when I came to visit you at your location, you have fantastic facilities, and it's very rare for a physical therapist to have that kind of facility in the UK.
Oh, okay.
Yeah.
All right. What, so we'll get back. I got a few more medical questions for you too, but what kind of things do you like to do on your free time, like hobbies?
Well, that's one of the reasons that we really like Phoenix. I love the outdoors, and so does my wife, so we like hiking. We don't do anything too strenuous, but we like to get out there, and we have an Australian Shepherd puppy who likes to join us on hikes, so that keeps us busy. But I also like cycling. I've raced competitively in the past. I was in Kansas for the last 2 years, where people don't generally cycle. The roads are not really that safe for cyclists, so I'm a bit out of shape now, but I'm planning to get back into it and hopefully race competitively next year. And I do cycling time trials.
Okay.
Yeah.
Yeah, I've treated plenty of cyclists, and it's getting harder and harder, especially up in this area, the northern part of Scottsdale and Phoenix, for cyclists to get out, because the roads are just getting so congested, and it's just busier and busier with population up here.
For sure.
I know Arizona's a very big cycling state.
Oh yeah, absolutely. A lot of good cyclists in the area.
Oh, awesome.
Yeah.
So I know too, you had recently, you had a kind of a fellowship award that you had, sort of, do you want to kind of expand on? I'm simplifying that more than I should.
Yeah, so I just got back a couple of weeks ago from the Arthroscopy Association in North America Travelling Fellowship Award, and what that comprises is that every year 3 or 4 orthopedic surgeons from across the US receive this award, and what that allows us to do is to travel around the US and visit other high-profile surgeons and exchange knowledge with them. So one of the highlights of this fellowship for me was to visit Vail, which is the Centre for US Olympics, the medical centre for US Olympic ski team. And I've recently been involved in a study with the French national ski team, and what we demonstrated was that if we do an additional procedure on the lateral outer side part of the knee at the same time as an ACL reconstruction, we reduced the graft rupture rate by 5-fold, which is a huge improvement. Sure. And we've also demonstrated that those same findings exist to the general population. So I actually have a large number of publications on this topic, and it's something that we're doing quite a bit of work on. And actually at the upcoming American Academy of Orthopedic Surgeons and Arthroscopy Association of North America annual conferences, I'm going to be presenting our long-term results of that, which is going to be the first long-term study on this topic. Okay. So that's pretty exciting.
And what is the time frame on that? I mean, say long-term.
100 months.
Okay.
Yeah. So around 9 years.
Oh.
Yeah.
Good, long enough data point, that's for sure.
Yeah, for sure. And the really exciting thing is that we demonstrate that even with that long-term follow-up, we've got a very significantly reduced graft rupture rate for patients who've had a combined reconstruction. And this is a really important topic, because one of the main concerns after ACL reconstruction is that graft can fail.
Yeah.
So this is a really important finding and a really great technique that we're doing more and more in our patients.
It's always good when you make advancements like that with orthopedic conditions, especially with surgeries that have tendencies to have those type of issues. And appropriate, because my wife recently just had an ACL surgery herself.
Oh, she did? Okay.
A skiing accident.
Right.
So, certainly that population comes across with ACLs all the time.
For sure, yeah.
Well, along those lines, and I know you mentioned the balloon, do you know of any other orthopedic advancements that you see coming down the road as far as, new technology or new techniques?
There's always new techniques coming along, and I think one of the important things is not to just jump on the bandwagon, but to really do a critical appraisal of any new technology, so that when we offer it to our patients, we know that it works. So there's one technology which I've introduced to my practice about 3 or 4 years ago, which is becoming increasingly popular. We have good data for that too to support it, and that's for those patients with partial rotator cuff tears. So it's not a complete tear, And previously what we've done in this situation is initially treat them non-operatively, so we'd be sending them to you for rehabilitation, but those that aren't successful with the rehabilitation, they would either go on to have a repair in situ, which means that we don't take the whole tear down and repair the part on, or we complete the tear fully and then fix the whole thing. And that has advantages and disadvantages, but with this new technology, it's called bovine collagen patch. We just go in there, again it's a very quick keyhole procedure, so there's just a couple of very small incisions, and we put this patch onto the damaged tendon and it thickens it up and shares load with the native tendon and reinforces it, and it's really great for reducing pain. The recovery is very quick. So one of the disadvantages of the previous procedures I mentioned is that typically patients would be in a sling for 4 to 6 weeks afterwards and then need an extended period of rehabilitation. But with this new technique, they're only in a sling for a couple of weeks and they can get going pretty much straight away with exercises, and the recovery is way shorter.
What is the time frame on that patch, basically taking on the whatever anatomy it's going to take on within the shoulder, in terms of if a patient were to ask time for that patch?
Yeah, there's some limited data on that now, but we know that by about 6 weeks it started to integrate pretty good.
Okay.
We know that from some animal studies where they've gone in and taken a bite out of the patch and sent it off to the lab to see how it's integrating. Okay. But we also know it from analysis of patients and how they do after surgery, and usually by 6 weeks they have pretty good pain relief, usually a lot earlier than that as well.
Okay.
Yeah. Another good thing I forgot to mention about that patch is that one of the main concerns for our patients who have partial tears that aren't having the traditional surgery is that they can get bigger with time. And so we might see a patient today, for example, and they're doing okay with their shoulder, but they have a partial tear, and then they might not come back to us for 5 or 10 years. But at that point when they come back, our main concern is that tear has got bigger, and sometimes it can get to the point where it's so big that it's difficult to repair. But this patch has been shown to limit the rate of progression of tears, so that's pretty exciting finding.
Yeah, certainly it keeps people potentially in a surgical option if need be when they finally decide to make that jump.
Yeah.
Gotcha. Good stuff. So with these videos, I tend to try to ask or anything along those lines. What's your favorite movie of all time?
I like westerns a lot.
Oh.
So Young Guns, actually. Young Guns 2 is my favourite western movie with Emilio Estevez.
Yeah. Nice. I haven't heard that one, but I'm trying to think of those. Were there 2 or 3 of them?
There was 2 of them, yeah.
Okay.
The first one was good, but it wasn't as good as the second one. Just, I think the cinematography was just, the chemistry between the cast was really good.
Okay.
Yeah.
We kind of delved just a little bit into therapy, but what are your feelings as far as how therapy correlates with a lot of what the patients that you see in your practice?
I see it from the point of view that it's a really important team dynamic between the surgeon and the therapist, and that's essential for having the best possible results for our patients. So I really like to work very closely with therapy. We do a lot of research in terms of trying to define the best rehabilitation therapies, and we have a number of studies on that published recently. One particular one that is really important is that a lot of people get stiffness of the knee after a knee injury. Often they can't straighten it, and we call that an extension deficit, and that's very common after ACL injuries or acute knee injuries. And we have a video that's one of the most viewed videos in some major arthroscopy journals, and it basically shows a technique that we use in physical therapy to get the knee straight, and it works really nicely. But in addition to that kind of work that we're doing, we just like to work closely with you guys and use the latest techniques to get the best results for our patient.
Perfect. Just based on a question I was going to ask you, because you got me thinking about what that video might be, but I'll have to look at it myself.
For sure, I'll send it to you. Yeah, it's a great video, and we've had such great feedback on it. I think it's one of the really challenging conditions that we see almost every day in our practice with patients who've had knee injuries, and a lot of the time the focus is on different aspects of trying to get that knee straight. but this is a really reliable and good technique, and
Okay.
that's why the video's been so popular.
Yeah, I mean, I know with patients, inevitably for the patients when they come in after a knee injury, whether it be surgical or non-surgical, it's always the fear of getting the knee to bend.
Yeah.
And you know, you've got more time to get that bend, and it's always the education part of teaching the patients to get that extension early.
Yeah.
You know, avoid putting something under the knee to make it more comfortable, which is typically just becomes a snowball effect
Yeah.
of it not wanting to straighten.
And I keep mentioning that we have a lot of research, but another area that we've researched is that with this particular technique we demonstrate in our video, if you do that, you get the knee straighter more quickly, and that avoids something called cyclops syndrome.
Mm-hmm.
So in patients who don't fully straighten their knee after surgery or an injury, the space behind the kneecap can fill up with blood, and that forms a scar tissue, and that stops the long-term straightening their knee, and often they need surgery to free that up. So just with the technique in this video, we've demonstrated that you can avoid this particular issue.
Yeah, so whenever you send me that video, we'll make sure and we'll get that posted on at the end of this video as well, so you'll be able to access and take a look at that yourselves.
Great.
Lastly, with all the doctors we talked to, if you had a young kid coming up to you, a high schooler that was possibly interested in medicine, and asked you what was your opinion of getting the medicine these days with some of the things with COVID, the fear, you know, COVID and insurance changes and liability risks, those kinds of things. Like, how would you respond to a young person asking you about medicine right now?
I think there's a couple of things to consider. The first is that I was so lucky to have a really great mentor, and the problems that you describe or the issues you describe, they might not be the same in every single field that you could possibly go into, but there's always challenges in different employments, whether it's COVID or something else. So if a young person was coming to me, I'd want to inspire them and share the joy that I have from surgery. And you know, one of the most amazing things for us is that you see someone who comes in injured and you do a surgery and get them back to doing what they want, and the satisfaction I get from that on a personal level is just, you know, it makes everything worthwhile. And I think that, you know, as a young person, that's one of the things that inspired me to get into it. So I would encourage them from that point of view. And you know, all those other issues, yes, they're considerations, and you have to think about whether that's something that's right for you. But at the end of the day, we do this because we enjoy it, and I think that's the most important thing for a youngster to understand, that they've got to really find something that they enjoy to do for the rest of their life.
Yeah, that's a good answer, and that's a very consistent kind of response from the physicians as well.
Right.
It doesn't really, I mean, pretty much every occupation's got its risk of some sort of kickback, you know, of a problem, and doing what you love to do and taking the risk to do those things, the benefits at the end of it outweigh it.
Yeah.
You can find what that is and what inspires you, and you can take the most pride in it. It's rewarding to be able to go home and look forward to going to your job the next day.
For sure. Yeah, if you enjoy it, it's not work.
Yeah, exactly. Okay, well, once again, thank you for joining us for
Thank
the
you.
Community Spotlight. Again, at the end of this video, we will be putting up some information on where you can find Dr. Saithna for if you need to get an appointment to see him for his specialty, as well as there'll be some more information on there regarding total sports therapy. Keep checking back. We want to try to keep adding more videos with other specialists in the valley, and we appreciate you watching.